So for our impact of the Affordable Care Act executive summary, we identify the goals of the Affordable Care Act to include establishes the legal framework for U.S. citizens' access to health insurance from birth to retirement, a reduction in the number of the uninsured by 31 million people in the United States. The Affordable Care Act assumes that shared responsibility is assigned to governments, individuals, and employers with a goal of improvement in fairness, quality, and affordability of all health care. Improvement in healthcare value and efficiency is the second goal, and then improvement in primary care and public health.
The impact of the Affordable Care Act access mechanism. The Affordable Care Act expanded coverage through two key mechanisms. One being Medicaid expansion for those with the lowest incomes, and the other being federal subsidies to purchase private coverage in new health insurance marketplaces for those with moderate incomes. Access also includes the following. Young adults can remain on a parent's plan until their 26th birthday through private employers. Individuals get comprehensive insurance regardless of health status, and it requires that individual obtain insurance or pay a penalty. The Affordable Care Act substantially improved access to care among non-elderly adults. Relative to 2013, insurance coverage in Medicaid expansion states increased by 6.5 percentage points in 2014, 9.7 percentage points in 2015, and 11.8 points in 2016. The American Care Act also increased the likelihood of having a primary care doctor, with the effects growing over time. It also increased the probability of reporting excellent health and reduced days in poor mental health. According to the National Center of Health Statistics reported 2019, the number of uninsured has decreased from 15.4% in 1997 to 9.4% in 2008.
For the cost component of the Affordable Care Act's impact, we first discuss it at the federal government level. The initial authorization for the Affordable Care Act was for $100 billion in mandatory federal funding and another $100 billion in discretionary federal funding for fiscal years 2010 through 2019. That equated to $63.50 per capita per annum in costs. The $100 billion in mandatory funding and the other $100 billion in discretionary funding were targeted for the direct financing of new insurance programs, as well as an extension of existing grant programs, and to supply new tax credit options and rebates to consumers, nonprofit agencies, and state and local governments to incentivize implementation of the Affordable Care Act. The highest amount utilized of that funding source was in year one was to California, which utilized $1.143 billion. The lowest amount in year one in 2010 was to North Dakota, only $22 million. On a per capita basis, the highest amount was utilized in Rhode Island at $108.90 per capita, while the lowest amount utilized in year one was in Florida for $15.14 per capita. Budgeted sources and purposes of funding for the Affordable Care Act's costs included 47% from employers and businesses, 21.8% towards private insurance and the exchanges, 8.2% for Medicare and Medicaid, 8.1% for health centers, and then a combined 14% for prevention and public health, maternal and pregnancy funding, workforce and training, and healthcare facilities and clinics. At the state level, in terms of the impact of the Affordable Care Act on cost, state exchanges and regulators are expected to eliminate pre-existing conditions as a basis for not only pricing, but also for waiting periods in excess of 90 days for treatment. Also, from a cost standpoint at the state level, beneficiaries' children were allowed to continue to be enrolled on a parent's insurance plan to age 26, regardless of their status as an active student. The states were also expected to expand Medicaid enrollment by allowing inclusion of the poor and working poor, with a cap of 138% of the federal poverty standard. 138% equals approximately $16,000 for a single person in income. The Affordable Care Act also banned lifetime financial caps for consumers' health treatment costs. In terms of cost controls, moratoriums were placed on the expansion of physician-owned hospitals as a part of the Affordable Care Act. Also, there was a prohibition on any new construction of physician-owned hospitals. Hospitals were incentivized to significantly reduce hospital-acquired conditions and patient readmissions. Movement away from treatment as volume-based care and movement towards value-based or performance-based care were also conditions for hospitals in the Affordable Care Act. And then the creation of Affordable Care Organizations, or ACOs, which shift financial risk within Medicare from CMS to the healthcare provider, was an additional condition.
Impact of Affordable Care Act quality. Managed care initiates have almost become mandatory, hence influencing cost and insurance. Initiatives are intended to have a mixed effect of access and act as a source of primary care, in addition to lowering the number of people using inpatient and emergency services. The impacted on quality care, since it has led to a completely new definition of professionalism, where patient satisfaction is measured to ensure professionals are kept on check. Exchanges are online markets where individuals or businesses can learn about healthcare coverage options. Compare and contrast those options and choose a plan if they want to enroll in the insurance coverage. Some states have partnered with other states to create access to these websites, whereas others have joined with the federal government in the implementation of the exchange, while some have opted out of the plan. The state and national policymakers are facing challenges in the implementation of the ACA. According to Kashi, over one half of the states and some private companies filed a lawsuit challenging the constitutionality of the act. A large percentage of Americans were also in favor of repealing the law, and most people are unsure up to date. Gruber states that this has led to the implementation of policies that force Americans to obtain coverage. Failure to do so attracts a penalty.
In conclusion, the Affordable Care Act has had a profound impact on the U.S. healthcare system in terms of access, cost, and quality. Medicaid access has been expanded to cover 31 million additional citizens who were previously uninsured. And $200 billion has been allocated from the federal government for the expansion of the Affordable Care Act programs for a 10-year period. The Affordable Care Act is an effective law because it has enabled millions of U.S. citizens who previously did not have access to health coverage acquire it. Americans with pre-existing health conditions do not need to worry anymore about being denied health coverage or paying premiums which are higher for their health conditions. This law has also saved billions of dollars on prescription drugs and also cut on health expenditures. References: